Let's talk about the neurodiversity affirming approach using naturopathic medicine principles. So, as a naturopathic doctor, I was trained on these 6 principles in my education, and that's the healing power of nature, identify and treat the cause, first, do no harm, doctor as teacher, treat the whole person, and prevention. So, those are the 6 principles. Fun fact, identify and treat the cause is something that functional medicine took one of these principles. We're able to repeat that enough times for people to understand that there are practitioners who are trying to treat the cause. It's much easier to scale this practice when you focus on one principle, whereas in naturopathic medicine, we have 6 principles, and it's a lot harder to communicate all of that information to every single person, as you could probably guess. And I created a neurodiversity affirming version of these 6 naturopathic principles. The first principle, healing power of nature, which is to honor the neurodivergent resilience and natural coping strategies like hyperfocus or pattern recognition, and to support these natural rhythms, sensory needs, and nervous system diversity through accessible environments, routine flexibility, and nature-based modalities that meet individuals where they're at. So first, understand that our bodies are inherently made differently, and to understand how we are perceiving reality differently, experiencing our realities differently, inherently by nature, should be one of the first steps we take as clinicians. And then the next principle is identify and treat the cause, which is look beyond surface level symptoms and behaviors to understand the context for sensory overload, systemic stress, unmet support needs, avoid potentially pathologizing traits that may be natural expressions of neurodivergence, treat the root cause of distress, support the individual, and see what that expression of difference actually is. Because if a person's in burnout, if a person's not properly supported, then it may look more like a pathology versus a person in distress. We may just be pathologizing the distress. So identifying and treating the cause is really important from this perspective. Third principle, first, do no harm. And a lot of times this looks like starting with the least invasive approach first in the neurodiversity affirming model. So that means you humanize before you pathologize inherent neurodivergence. That's how you can first do no harm. You have to respect the autonomy and the lived experience and consent. Refrain from imposing conformity to neurotypical standards and norms as a measure of success. I like to say neuronormative. Recognize that harm can come from invalidation, from sensory coercion, or forced masking. These are ways as clinicians that we can avoid doing harm first and foremost. The fourth principle, doctor as teacher. We can foster collaborative learning that empowers the neurodivergent individual with knowledge about their bodies, minds, and needs. So validate these diverse communication styles and support self-advocacy, and educate not to fix, but to co-create understanding and develop that self-trust. I can tell you that this was so important for me because the more that I learned about myself, the more self-empowered I became, the more independent I was able to become. By not understanding myself, by not understanding sensory needs, by not understanding my disabilities, I was floundering and actually never able to understand anything, myself or others. First, if we are doctors as teachers on a fundamental level, then this learning can empower neurodivergent individuals to capacities they might not even know that they have, because they are not aware of all the things that they need support with. And that is something that we can help with. We can help give them the verbiage or the awareness and understanding that can help elevate capacity, essentially. And now we're on to principle number 5, treat the whole person. So that means you support holistic well-being. That includes nutrition, emotional needs, sensory regulation, support across the cognitive, physical, social, and spiritual dimension. Recognize the richness and complexity of neurodivergent identity, including the co-occurring conditions, including sensory profiles, cultural differences, ethnic differences, and community influences. Care should be integrative, trauma informed, and deeply individualized. In order to be neurodiversity affirming, we cannot move forward with the one size fits all model that exists today in medicine. We must look at every single person as their own individual with their own individual health, own individual set of lived experiences, own individual neurological variances, and so on and so forth. Number 6, prevention. Promote environments and systems that reduce sensory, emotional, and social stressors. Preventions include reducing stigma. We must improve accessibility and support nervous system regulation, which is going to empower early support, not with the goal of avoiding neurodivergence, but of cultivating thriving across all neurotypes. What this basically is saying is that if we can prevent meltdowns from happening, if we can prevent sensory overloads from happening, if we can prevent all of these things, that is one of the principles of having a neurodiversity affirming approach. So integrating these principles is going to create a practice framework for clinicians that respects the neurological differences while still addressing all the genuine health needs as well.